My signature assignment is about anthrax, and let's find out what anthrax is. Anthrax is a rod-shaped gram-positive bacteria called Bacillus anthracis, and um, usually anthrax is found in the soil where animals can get infected. And what I mean by animals, I refer to livestock. And when these animals are infected, eventually the disease can be passed on to humans when consumed. There's three main different types of anthrax. The main one or the most common one is cutaneous anthrax. This one is disease of the skin and is mainly characterized by these blisters on the skin, most commonly in the face and the hands, and these blisters are necrotic tissue, usually painless. Pulmonary anthrax is when the spores of anthrax get to the lungs, and gastrointestinal anthrax is when the spores of the bacteria are in the gastrointestinal tract, such as the mouth, the intestines, and the stomach. And central nervous system, or when anthrax is in the central nervous systems, is considered in the advanced stages of the disease. And this is the most severe case or um, the disease when it's in late or advanced stages. This is a picture of what cutaneous anthrax looks, and this is the necrotic tissue that can form on the person that's infected with anthrax. The necrotic blisters will be mainly in the hand if the person has been working in the soil and somehow the bacteria got into the person. The signs and symptoms of anthrax are usually fever, cough, shortness of breath. There is internal bleeding from anthrax being in the gastrointestinal tract, extreme weakness, sweating, and when anthrax is invading the central nervous system, meaning the bacteria can be into spinal fluid or even the brain, it causes alter mental status. How do we diagnose anthrax? Because anthrax is not a common disease to be found like a cold or the flu, it's very important that the doctors pay attention to the signs and symptoms that the person is having to be able to identify the person at risk having anthrax. Usually, anthrax is diagnosed with the help of x-rays and the cases where the person has respiratory symptoms. Blood samples are usually taken for culture and sensitivity to be taken to the lab and examined. The skin lesions or the necrotic tissue are usually swabbed to confirm or verify that the person is um, having anthrax blisters. And in the most severe cases, when anthrax is in the central nervous system and does not present any obvious signs of having anthrax, the spinal fluid is collected and sent out to the lab to be tested. How do we treat anthrax? Because anthrax is a bacteria, the most go-to treatment it's antibiotics. Usually the person will be started on a broad spectrum antibiotic just because we want to start treatment as soon as possible because anthrax is a very deadly disease to acquire, especially if is gastrointestinal anthrax or the upper respiratory anthrax. Doxycycline and ciprofloxacin are the most common antibiotics used to treat anthrax, and an antitoxin to treat the endospores. It's usually used to um, kind of avoid or stop anthrax from multiplying so rapidly because the spores rapidly proliferate in the body. Um, the person that is at high risk of contracting anthrax will have to use personal protective equipment to prevent acquiring anthrax, such as gloves or a gown and glasses and even a mask if they're working directly with soil and there's a suspicion that there's contamination. And these are my references. Thank you.